Good evening, everybody. We'll start with today's session. We're discussing regarding the potency and its repetition. And in last 2-3 lectures, we were discussing about the same thing. We have finished with the aphorism number 276, 275 and 76, where he has mentioned exactly that the larger doses or stronger doses always cause an aggravation, even though they are chosen on the basis of law of similars. And it was his own experience and experiment, because of which it was it has happened that he he recognized the aggravation which is caused because of it, and ultimately he started reducing the doses. And then he understood that when you reduce the dose, still it works. And then he reached to a certain level where there is absolutely very minute amount of medicine was present and still it was working. And then he developed the two methods of potentization and he started working on it. And he thereafter also he started finding it out that medicine works when you used it on the law of similars. So it is a big hard work which he has done in order to develop a potentization method, and it is not a product of one day experimentation. It was a product of experimentation, years of experimentation, and because of which he came to the conclusion that when you dynamize the medicines, the inherent properties of the crude drug substances, they comes into activity. And because of which he reached to that level. Then question arises that people, they were not happy or they were not accepting his thought that medicines in such a minute doses works. They used to give it high potency, in fact, not high potency, but in material doses. And material doses in large quantity, strong doses used to cause more harmful effects. And that he mentioned over there in those aphorisms. Either you choose it on the basis of law of similars or either you choose it on the law of dissimilars. But it used to produce such a harm that causes a trouble. And that's why he was in the search of finding it out a minimum dose, and he reached to the potentization level. But how much minimum? That thought was there. How much minimum? And that's why when he reached to the law, he explained it in such a manner that you can apply it from individual to individual in a in a in relation with that specific individual. So he defined the law of minimum dose. The dose should be so minimum so as to arouse the vitality in a diseased individual. See, if you define it like that, so it varies from person to person. For one person, the 6C might be a stronger. Another person, it is 30 might be a stronger. Another patient, it might be a 200. In another patient, it might be 1M. It varies from individual to individual depending upon many factors. When you think about the dynamics, the question of judgment comes. When you think of a material, there is no question of judgment. Then you define the specific dose, which is there in allopathy. So this difference is because we deal not with the material human being, we deal with the dynamic human being, because the disease always happens at the dynamic level. And if you want to treat the dynamic diseases, you require dynamic medicine. And in order to find it out right dynamic potency, you have to be depend upon the judgment, which is based upon many factors. So he is coming towards the how much minimum dose to explain that. And that's why he is explaining it with different examples, with acute conditions, with chronic conditions. So what he says in aphorism number 277. For the same reason, and because a medicine, provided the dose of it was sufficiently small, is all the more salutary and almost marvelously efficacious, the more accurately homeopathic in its selection has been. A medicine whose selection has been accurately homeopathic must be all the more salutary the more its dose is reduced to the degree of minuteness appropriate for a gentle remedial effect. So now he explains that if the simillimum is very perfect, you are damn sure this is the remedy. You are damn sure the person is typically belladonna, the person is typically rustox, the person is typically naxomica. 100% you are damn sure about the remedy. Then it should be given in a most minute dose, means higher potency. Keep it in your mind. You have to make it more minute, means you have to go for high potency. So higher the simillimum, potency should be higher. Yesterday we have learned two laws. First law, which I have explained, higher the susceptibility, higher the potency, less is the repetition. That's what I have told you. Then second law, which I have told, lower the susceptibility, lower the potency, repetition till the susceptibility get aroused. Now, third thing which also I have mentioned yesterday, that it depends upon where exactly you want the result. The potency should be selected on where exactly you expect the result. Today, he is explaining more perfect is the simillimum, higher the potency. Means very minute dose should be. And more the perfection is there in the simillimum, it means you will require just a stimulus in a higher potency. That's all. You don't have to repeat it too much. There is no need to repeat. So you have to give the medicine in a higher potency when you select a remedy on the basis of perfect simillimum, and which is possible in acutes. Because in acutes, the data is available. It is of a recent origin. Patient will going to give you all the features very easily. Nothing he forgets, which is possibility in chronic. Acutes, he never forgets. And that's why you can easily get all those things. So you get perfect simillimum in acutes, and more the perfect simillimum, higher the potency. This is what another rule, you must write it down over there. So we have learned 3-4 things regarding the potency selection and repetition. And now one more thing, what he wants to explain in 278, we'll finish that in today's session. Here the question arises, what is this most suitable degree of minuteness for sure and gentle remedial effect? How small, in other words, must be the dose of each individual medicine, homeopathically selected for case of disease to effect the best cure? So question arises in everyone's mind. When you call materially, you can tell, yes, 30 is minimum than 200. It is 30 milligrams is less than 200 milligram because it is material, you can measure. When things are dynamics, you cannot. And that's why the question arises, what do you mean by minimum? You cannot define because it varies from individual to individual. For one person, it might be a minimum is 6, another person, minimum is 1. And that's why he explains over there, to solve this problem and to determine for every particular medicine what dose of it will be suffice for homeopathic therapeutic purposes, and 8, be so minute that the gentlest and most rapid cure may be thereby obtained. So it depends upon one more factor, what medicine you will going to use. That is another factor which you have to take into consideration. Why? Because there are certain medicines which are in their crude states acts dynamically. They are so stronger in crude states also. We'll take a simple example of onion. If we are cutting the onion, it directly acts. It processes, it stimulates your nasal mucous membrane to discharge. The watery discharge comes from the nose, watery discharge comes from the eyes. There is irritation in the nose, irritation in the eyes. See, you're not consumed the onium, still it starts acting even a crude form. So how much stronger it is, you can find it out. And when it is such a strong medicine, which acts even in crude form, then that medicine should not, there is no need to potentize it to too high level. You can use 30 to 100, maximum 1 m. There is no need to go 10 m, 50 m, cm, because it is the remedy which acts so fast. It has a acute pace. It works instantaneously. And when it works instantaneously, these medicines acts for the short time. Then the effect never remains for longer time of duration. It remains only for certain time. And that's why such a medicine will not cause or will not remain show permanent effects on the body. Those are short acting, and in such types of cases, you you have to select potency according to the patient's susceptibility as well the medicine which you are using. There are certain medicines which are very slow in its action. In their crude form, they never shows anything, and such you have to dynamize more. So it depends upon medicine. That is one more factor. So it varies from medicine to medicine. See how many things you have to take into consideration when you are selecting the potency. It never depends upon one factor in homeopathy. And that's why potency selection always remains to be a dilemma unless and until you take into consideration all those aspects. So we have learned that we have to just depends upon susceptibility. You have to depend upon what pathology or disease you are treating. The third thing, how much minimum you have achieved, and now which medicine you are providing for the patient. That is also one part which you have to take into consideration so that you can get the gentlest and most rapid cure. Another answer which he gives over there to solve this problem is, as may easily be conceived, not the work of theoretical speculation. So it is not theoretically you can prescribe it. You have to understand it practically, exactly what exactly you are treating. You have to judge it on the basis of clinical examination, observing the patient susceptibility, patient state, patient disease, everything. Not by fine spun reasoning, not by spacious sophistry, can we expect to obtain the solution of this problem. So it is just not like allopathy. It is not so rigid fixed, like 5 milligram per kilogram of body weight, 10 milligram per kilogram of body weight. It's not like that. It varies from individual to individual. It varies according to the age. In children, the susceptibility is very high. So you have to take into consideration that also. In geriatric cases, the susceptibility is low. That also you have to take into consideration. Males and females, gender also plays a very vital role. In case of males, intellectual susceptibility is much more than emotional susceptibility. In case of females, the emotional susceptibility is more stronger than the intellectual susceptibility. All things which you have to take into consideration when you deal with the case. And that's why it requires a practical application. It's a part and parcel of learning it in the OPD and then understanding why such and such potency the person has used. It's not the thing which can be taught theoretically, because there is nothing material which we are talking about. We are talking about the dynamics. And when we are talking about the dynamics, we have to learn the dynamics, the human being. It is just as impossible as to tabulate in advance all imaginable cases. So there is no fixity. You cannot fix, yes, I will going to give this remedy to that patient. Yes, patient comes to you with Duchenne muscular dystrophy, and I will give this remedy and in this potency. It's not like that. You cannot imagine. Ultimately, when you deal with the patient, then your remedy You can find it out on the basis of similar. Then you have to take into consideration all these parameters to find it out, right potency. Then you have to think whether to repeat or whether not to repeat. Many things comes into play when you are dealing with such types of patients. Pure experiment, careful observation of sensitiveness of each patient, and accurate experience can alone determine this in each individual case. And he has written it in italics. So it varies from individual to individual. It is not rigid, it is not fixed. For every patient, you have to clinically examine, you have to take into consideration the whole case, then you have to take into consideration the sensitiveness, susceptibility of each and every patient, and your accurate experience means you have to all your judgment regarding all those things, and then you can select the potency in each every individual case. And it were absurd म्हणजे मूर्खपणाचं to adduce म्हणजे सादर करणे, दाखवणे the larger doses of unsuitable allopathic medicines of the old system, which do not touch the disease side of the organism homeopathically, but only attacks the parts unaffected by the disease, in opposition to what pure experience pronounces respecting the smallness of dose required for the homeopathic cure. I will tell you this part with example. Patient comes to you with severe headache. He's in a disturbed mood. You observe on his face that he is not normal. Something is wrong with him at the mental level. Something has happened in his life. And he's having severe headache. You examine his blood pressure and blood pressure is high. Then you ask, what's wrong with you? What has happened? Because patient is young, So why he is getting the hypertension and what is wrong with him? Why he is looking so stressed? And then after poking, you get, yes, doctor, there is some stress in my mind. I was in relation with someone and we have a breakup. And that disturbed me a lot. Patient is telling you the reality. The things that happened at the dynamic level, nothing material entered inside the body. But this dynamic disorder, the dynamic thing which affected his vital force, producing a dynamic disturbance and reflecting in the signs and symptoms in the form of headache. And if you check, the blood pressure is high enough. No allopathic medicine will going to cure him forever. They will check the blood pressure is high, they start giving antihypertensive, finished. Patient is of 26 years of age, starts taking the antihypertensive. How much time? It has been written that till you are there at the funeral, you have to go on taking this, nothing more than that. This is too important because no allopathic medicine will touch his dynamics. But he is in a problem. The disease is at the dynamic plane. And what is the disease in this case? You have to understand that disease. If you are finding it out, homeopathic remedy for this case, that remedy should work at that dynamic level so that his headache will disappear, his blood pressure come to the normal, and he will never suffer from it again. So what is the disease in this case? Anyone? What is the disease in such case? Simple case. This is the case. And these are the common problems in your opinion. Why he is having the headache? Why he is suffering from it? It is not the disappointment only.
Guilty feeling.
He is not accepting the reality is the disease. He still is in the delusion. He is not accepting reality that yes, next person is saying no. He has to accept that someone says no. He is not accepting the reality. That is the problem. That's why he is in the delusion. And that delusion is creating a disorder. In fact, this is the concept as explained by Rajan sir. This is as a delusion in his spirit. We used to develop this because we never remains in reality. We used to remain in delusion, and delusion is a disease. That has reflected producing the headache. So if you choose a right remedy, for example, you have chosen Ignatia for that case, you give Ignatia in 1 m or 10 m potency a dose, and you ask the patient to return back up next day or after 2 days. And if you ask him how he's feeling, he says there is no more headache. You checked his BP, blood pressure is normal. Then you ask, how do you feel? He says that much better than 2 days before. I'm much better. You can observe that the changes on his face. He becomes rather fresh than the depressed face. Because now he started accepting the reality. Homeopathic remedy touches to that dynamic level which allopathic medicine will not, because they never considers what is wrong with the patient. They consider, yes, blood pressure is high, give the antihypertensive, that's all. And this is what Hahnemann explains over there, that if you want to find it out a right remedy, it should be in proper potency, and we should touches that specific level where allopathic larger doses never touches. And that's why in chronic diseases, allopathy never have permanent cure. They have only palliative mode of treatment, where we have a lot of medicine to cure those disorders. And this is the difference which one has to understand. So we have learned few important things. We have learned first law, higher the susceptibility, higher the potency, less is the repetition. Second, lower the potency, lower the susceptibility, lower the potency, repetition till the susceptibility get around. Number 3, that the which disease you are going to treat, where exactly you want to focus your attention, where exactly the patient wants result, whether more superficially, whether in the muscular level or bony level or metaphysical level. That is another third point which you have to take into consideration. Then fourth thing, that is how much simillimum is there to find it out a right remedy. If simillimum is perfect, higher the potency and less the repetition. And then next, that is generally happens in acute. So that's why it is related with the acutes. Then next point, which medicine you will going to prescribe. That also matters. So Naxomica, there is no need to go for high Naxomica 1 m, 10 m. Not needed, because Naxomica in acute phase also produces its own effect directly. So it depends upon remedies. Chamomilla, there is no need to go for high chamomilla, because in acutes it has a strong action. So it depends upon what medicine you are selecting. That is another point which he has touched over there. So these are very essential things which he has mentioned about it. One more point which he wants to highlight is related with the chronic disease, that we're going to learn in tomorrow's session. So tomorrow we'll have this session, but tomorrow we'll not have divine school session because of some reason, because of some prior appointments. So we'll have only a regular session at 6 o'clock, and we'll continue with next 2 aphorisms in tomorrow's session, where we'll learn how one should go ahead with the chronics, and what is the how homeopathic aggravation takes place in acutes and chronics. So that's all for today. If any queries are there, yes, definitely we'll have a discussion. Otherwise, we'll
सर
yes, Madhu.
सर आपली होमिओपॅथिक ट्रीटमेंट चालू असताना हळूहळू नंतर आपण ॲलोपॅथिक हायपरटेन्सिव्ह ड्रग्स कमी करून नंतर बंद करू शकतो का सर?
हो, 100%. पण पहिली महत्वाची गोष्ट, यू हॅव टू फाइंड इट आउट व्हॉट इज द कॉज ऑफ हायपरटेन्शन. You must know that you should not just give the medicine for hypertension. It is not so. You have to understand what is wrong with the patient. whether the disorder is dynamic only or whether it is pathological also. That also you have to take into consideration, and that's why you should be a good clinician. So you must able to understand diagnosis behind that. I had a case. I will share that case. It was very nice case to share. Patient was there was a phone call for me, doctor. One patient I want to bring to you, and patient is since last 8 days he is continuously vomiting and there is severe acid peptic trouble. He has shown to 2 3 doctors over here, and they said that it's very hyperacidity and he's not. They have prescribed medicines, injections, but nothing is working, and he's continuously vomiting. And when patient was brought in front of me, he was looking toxic. Instead of taking the case, I first checked his blood pressure. Just I want to check. I I just checked it, and it was found to be 240 by 140. So I asked that something is wrong. I will not going to prescribe remedy directly unless and until I investigate your case. Ask them to do everything. I asked them to go for serum creatinine, blood urea, because that vomiting, I thought it is definitely not having acid peptic origin. It is a uremic. So I asked him to go for it, and he found that creatinine was 7.8. His blood urea was raised to 140 or like that. So you should be a very good clinician if you want to treat that patient. First, understand the patient when you are treating that patient. Then think what may be the wrong with the patient. Then you deal with that patient. Then accordingly you start your treatment. But you must know what he is suffering from. And then you have to investigate him properly. Then you have to go ahead with your own weapons. If you don't have confidence to treat that, at least refer that patient to a proper man. Because if he is in CRF, then you at least you should be strong enough to treat that CRF with your own remedies. If you are not sure, at least you should be in best hands. These are things which you have to take into consideration. So when you are dealing with antihypertensives, start reducing it, but first find it out what is the reason because of which the person is hypertensive. You should find it out the dynamic reasons, but not only dynamics are there, whether it has created any pathology in that patient, that also we have to take into consideration. If the hypertension is because renal artery stenosis is there, then what you are going to do? So you have to take into consideration each and every point, and then you decide how to reduce the doses. Okay?
Yes, sir. Thank you, sir.
Oh.
And sir, nowadays the allopathic physicians lipid profiles हाय जरी असलं ते इकोस्प्रिन धडाधड देतात आणि त्याच्याने कधी अजिबात लिपिड प्रोफाईल कंट्रोल मध्ये सुद्धा येत नाही सर. आणि ते म्हणतात आयुष्यभर तुम्हाला ही गोळी घ्यावीच लागेल. पण
लिपिड
माझ्या एका
कंट्रोल
पेशंट मध्ये सर
करण्यासाठी लिपिड कंट्रोल करण्यासाठी इकोस्प्रिन नसतं.
हो सर, पण ॲलोपॅथिक सजेस्ट करतात सर. आपण
नाही
नाही करत, पण
त्याचं रिझनिंग वेगळं आहे. ते जे वापरतात ते प्लेटलेट डिसइंटिग्रेशन साठी वापरलं जातं. It has been only for platelet
अच्छा.
disintegration so that there will be no clot formation. But it is marketing. This is what my
Yes, sir.
thought is there. Because what is the cost of aspirin and at what cost it has been sold? No one knows.
अच्छा.
It costs one penny, and which has been
बापरे.
sold at 1.75 1 rupee 75 paisa or 2 rupees like that. That's the reason. But that is
आणि
not
सर थँक यू टू यू
regarding
बिकॉज ऑफ यू. तुमच्यामुळे क्लिनिकल एक्झामिनेशन प्रत्येक पेशंटचं करण्यात येतं. बऱ्याचशा गोष्टी दिसून येतात आणि नाईस ऑक्झिलरी मेजर्स तुम्ही सजेस्ट करतात आणि मग छान लाईन ऑफ ट्रीटमेंट जुळून येते सर. थँक्यू सो मच.
Thanks a lot. So today we'll conclude. Tomorrow we'll meet with the next 2 aphorisms. Thanks a lot. Thanks Satyanarayan ji, Varke sir. There are many more.